The UCR team has come about because of a national directive. It is available for anyone in the community from 18 and above, but primarily our patients tend to be more elderly, more frail, who are at risk of admission or actually don't want to go into hospital. And what it basically does is allow patients to have access to a full multidisciplinary team within 2 hours.
There's been a real push on being able to provide healthcare at a very high level within the community, rather than take patients to A&E, which we would historically do.
So for the patient, receiving an MDT approach is really important because it's a one-stop shop. We come in, we look at all aspects of their life.
We're not just looking at that patient's overall healthcare, we're looking at how they're living.
Without the care input as well as the medical side and the therapy side, a lot of patients wouldn't be able to remain at home and would end up in hospital.
Some of them get so upset and distraught if they think that they've got to go into hospital.
So our service really offers choice and allows them to keep their independence and to have most of the treatments we can offer in hospital in their own home.
Referrals can be accepted between 8 a.m. and 8 p.m. Choose option number 3 and it goes straight through to the team, so there's no waiting in a queue.
Anyone in the community really can refer in, so this includes GPs, so GPs that are based in practices. It can be any community team, so a community matron, a district nurse. It can be paramedics. It can actually be the patient themselves, so patients can self-refer. Or it can be someone in social care, so someone from a care agency, or if a patient is resident in a care home or a nursing home setting, they can be referred by the staff there. So the referrer base is very wide.
With UCR now, the verbal referral comes in, the referral goes straight onto the system, and the call is put straight through to the relevant team.
I think it's also quite good for the referrer to know that we use the same system to document on as well.
You can see previous referrals, you can see hospital letters, you can see what the GP's written, what the matron's written, everything's in one place, so it's really good.
And moreover, then get to see the progress of what's happened to your patient, because entries are entered into your clinical system where you can review the notes. So a winner all round for everyone involved.
Our role is, once we've got that 2-hour response referral, to go out and do our holistic assessment.
We're all integrated together, and if we have a referral we can point that very quickly and get the relevant person out to the patient for their benefit as well as the other services that it could impact on otherwise.
And you see the overall of the patient, not just, oh, you have a wound, I came here for your wound, or you have a cancer, I came here for your cancer. No, we'll do more. And if they have a fall, we can tell them, look, we can give you equipment, we can come this afternoon and bring you some Zimmerframe. And they look at me like, what, seriously, can you do that? They're like, yeah, of course we can.
And they'll be seen until they don't need our care anymore. Sometimes it's referring on to other agencies, but the end game is that patient is at home, they're happy, and they feel relieved that they didn't have to go into hospital.
I've used the UCR quite extensively. Last week I had a patient's relative call me. The patient had had a fall and he was in bed with back pain. He was the main carer for his wife, who was also unwell, and within 20 minutes there was a physio knocking on the door of that patient who had been at risk of admission. He was given advice about pain relief, he was given equipment, and that patient has remained at home. His daughter was very, very grateful for that input.
I think some of the benefits to CCAM are that it speeds up our job-to-job time, it speeds up our turnaround time, so we can refer suitable patients across to the UCR team, and then we don't have to spend time transporting patients to A&E, waiting in queues, waiting in the ambulance, waiting for triage. It just means that we can be available for the next patient at a quicker rate.
It's really easy to refer in, just picking up a phone, speaking to a fellow health professional and being able to pass on details and concerns in a timely and easy manner.
Using the UCR does make it easier for me as a professional, because I know that I can hand patients' care over to them for a short amount of time, and they can give that intensive input, and then they will hand them back to me to carry on their care at home.
It makes it easier for the GP it makes it better for the patient, it puts less pressure on acute hospitals and the ambulance service, so it's a win-win situation.